Hey YouTube, this is The Art of Prepping. Thanks for joining me on Medical 101. So the philosophy of this is basically to mitigate suffering and death of our loved ones and of course ourselves. Instead of relying just on your phone to call 911 or whatever your emergency number is in your area or country for medical supplies via an EMT or a paramedic or whoever the designated medical person is in your community, you might want to take some responsibility for yourself and to actually know some skills and to have some supplies. Now, let's get into some first aid skills. These are all going to be examples throughout this whole video, so this is not the end-all be-all. But this is something where, a starting point for all the new people asking me to do this video. And later on in the year, I'll actually have a video, if all goes well, about more intense medical supplies and examples. So I'll have physical videos and I'll show you some of my kits. But for now, first aid skills would be like how to make a splint, how to irrigate a wound, how to bandage that wound, how to help someone that's choking. Some trauma skills would be like how to deal with shock, how to deal with profuse bleeding, how to give CPR, how to work an AED, defibrillator. So in terms of the first aid supplies, of course, the first aid, when I refer to that, it's going to be basic supplies. And of course, trauma supplies is going to be obviously trauma related, which typically are more severe. And so the first aid supplies would be things like to deal with minor cuts and bruises and burns and upset stomachs, where the trauma would be kind of more focused on your airway, your circulation, any type of blood loss and shock. Now, in terms of what's in your first aid kit, and this is going to be different because we're going into the trauma kit in just a moment, but the first aid kit is going to be more basic. It'd be like adhesive bandages, antibiotic ointments, it'd be like pain medicines, anti-diarrheal, and any kind of prescription medicines, code packs, tweezers, gauze pads, gauze wraps and rolls, medical tape, tapes, scissors, ACE bandages, triangle bandages. It could be finger splints, antihistamines, mirrors, pin lights, dental crown repair kits, eye rinse, antifungal creams, nitrile gloves, alcohol pads, safety pins, tongue blades, thermometers, antiseptic wipes, and plastic bags. Now, in terms of your trauma kit, it depends, of course, if you're mobile or at home. So these are all going to vary of how much stuff you can even get into those kits and how much of a size is even practical for your kit. For example, your backpacking kit may not have half as much as maybe your home kit. Now, in terms of your trauma kit, you should have definitely some more serious stuff. I try to keep like 2 tourniquets in each of my trauma kits, and we'll talk about that hopefully in the near future. And of course, the type is up to you. You have to do research on all these items because there's not just one type of tourniquet. To my knowledge, there's like 5 to 7 that are pretty well known, and there's a lot of debate of which one's better for whatever situation. So tourniquets is a big one. Trauma bandages, trauma wraps, trauma pads, EMT shears, pain medicine, CPR mask, nitrile gloves, medical tape, SAM splints, pin lights again, we got alcohol pads, glucose, scalpel, we got plastic bag, airways, chest seal, blood coagulants, decompression needle, emergency blankets, glow sticks, tweezers, suture kits. Of course, not all of those everybody's going to be aware of or proficient or know how to even to use them. So, basically get those components and do further research on this video about which items are applicable to you, and continue to grow in your skills and your knowledge. Thanks for joining me on this video. I hope everyone's well. Hope everybody takes this to heart to get your first aid supplies together, and I'll catch you soon.